In today's Health Watch, a new report shows troubling patterns in the fight against cancer. The American Cancer Society reports that highlights rising cancer rates in women, in some cases higher than men. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News. Good morning. How are you doing? So why are women now at higher risk than men?
Well, what we're seeing is women were slower to quit smoking than men. So men took up smoking earlier, but over time, men started to quit smoking earlier than women. So some of this is a result of women are still smoking at higher rates, driving the lung cancer rates. But there are other factors at play here as well. We are seeing issues with HPV. That's the virus that causes cervical cancer. There was a vaccine that came out some 20 or so years ago for this. There was a lag in people starting to get vaccinated at the same time that cervical cancer screening guidelines got more complicated. So women were sort of confused about their screening, maybe less consistent. So we see, unfortunately, an increase in HPV-related cancers. And so, there are a number of different factors, but these are two of the main factors driving some of that difference.
How do we reduce our risk?
For women and men, for everybody.
Well, I think, to me, one of the most striking things in this report was the rates of lung cancer among women who do not smoke.
Yeah.
And so as we've seen those smoking rates come down, it sort of unmasked all of these other risk factors for lung cancer that maybe we didn't pay as much attention to. And so particulates in the air, so basically air pollution, definitely seems to be a driver of this. Radon in the home. There do seem to be perhaps some hormonal factors. So we know, for example, pregnancy is a period of immunosuppression, whether that's from the hormones or from other things that are happening during pregnancy. So how all of these things interact to increase risk in women is really something that needs to be researched a lot better.
We are better at treatment, though, these days, right? Survival rates are going up.
Yeah.
Yeah, for the most part, yes. And we've had some really great breakthroughs in terms of harnessing the immune system, either with monoclonal antibodies or cancer vaccines, that are really starting to make a big difference for folks.
Really interesting.
Yeah.
Dr. Gounder, thank you very much.